Now we are going to see the mechanism of fracture. Now, for the mechanism of fracture, this is actually the cause of how a fracture can occur. Is it clear? So you need to know that you have different causes for the fracture to occur. The first cause for a fracture to occur is in a case of a blunt injury. Is it clear? So when you are just, let's say you have a car that is just coming onto you and then it's knocking you down, that is a blunt injury. And every time that you have a blunt injury, you should speak about point of impact and should speak about the point of reception. Is it clear? And we have defined the point of impact as being the site where the initial injury is affecting the body. Is it clear? The site where the initial injury affects the body, while the point of reception is the site of the secondary injury. What does it mean? If you have a bike that hits you down, the site where the bike hits you is a point of impact, and when you are hit down, it means that you are projected onto the floor. The side where you hit your body to the floor is now the point of reception. Is it clear? That is for blunt injuries. The second part after blunting injuries, you have penetrating injuries. Penetrating injury. Penetrating injury, you should speak about the point of entry. Generally, with penetrating injury, you have sharp object that penetrate the body. Is it clear? So you can have a penetrating injury like somebody is trying to cut you with a cutlass and then he cause a fracture on the bone. Is it clear? So that's a penetrating injury with a fracture. Is it clear? Generally, with penetrating injury, you are going to have an open fracture, because there is first the penetration and then there's a fracture. So there's a communication of a bone hematoma with the external environment. Are you understanding? That is the next part with the point of entry. Now, after speaking about that in the point of entry, we speak about with penetrating injury, we must speak about point of entry. And sometimes there is point of exit with penetrating injury, particularly if it's a knife, it is entering somewhere and getting exiting somewhere. You can have also the gunshot injury. Gunshot injury has a point of entry. You must speak about point of entry, and you speak about the point of exit when speaking about in a history. In a history, when speaking about gunshot injury, you must speak about point of entry, and then you speak about the point of exit. Is it clear? All those are very important. Is it clear? And all that, when you have also gunshot injury, it's very likely that the bone hematoma communicates with the infractor environment, causing an open fracture. Now, after gunshot injuries, we have what is also called avulsion fractures, avulsion injuries. Is it clear? Avulsion injury occur usually usually at the level of the patella. Is it clear? Occur usually at the level of the patella, resulting to the Badger's deformity and the apter deformity. Is it clear? So those are the things that occur, because at the level of the patella, patella is an inverted triangle. Above on the base of the patella, you're going to have the quadriceps tendon, and below you have the patellar ligament. When you have a sudden abrupt movement of the opposite side, you're going to have a fracture, and sometimes the fracture can be associated with the lower displacement of the patella or the upper displacement of the patella. Is it clear? Those are associated now with Badger's deformity and the apter deformity. Now, the next thing after the avulsion fracture, we have also the twisting fracture. Twisting injury or torsional injury / torsional injury. Is it clear? Torsional injury. Now, in the case of, I'll first take twisting injuries or bending injuries. When you have a bending or a twisting injury, this usually occur when you are playing, is it clear, and then you are falling with an ankle sprain. Is it clear? You know that when you are sometimes running and then you do a varus or a valgus deformity of your leg, you do a varus deformity of your leg, or you do a valgus deformity of your leg at the level of the foot of the ankle joint. Do a varus or valgus deformity of the ankle. Is it clear? When you have those type of fractures of the malleolus, usually those deformities, there are twisting injuries, or twisting injuries also at the level of your wrists. Is it clear? Those twisting injuries are fractures mostly occurring at the level of joints. At the level of the wrist, you can fall, you can twist at the level of the wrist, and then you have a fracture there. At the level also of the head, like in the case of a boxer's fracture for the upper limb, is it clear? When you have a fracture there, is because of twisting still of the finger when a boxer is punching his opponent. Is it clear? Those are twisting injuries. After twisting, we have torsional injuries. Is it clear? Torsional injuries are mostly associated are the one that are in case of the production of spiral fracture because there is rotation, or you may have an initial fracture and then the movement of the redundant muscle on the fractured fragments. Is it clear? That's torsional injury. If somebody may be turning around and then he has a fracture of a side of the body, is it clear? It's mostly torsional injury. We have also compressional injuries. Is it clear? Compressional injuries. Example, when somebody tries to lift a heavy weight. Is it clear? When somebody tries to lift a heavy weight and then there is compression of his spine, he has fracture of the spine, a compressional fracture, a wedge or a burst fracture. Those are associated with compressional injuries. Now, other injuries that you can have crush injuries. In crush injuries, what happens is that it is mostly like they are crushing part of your body. Is it example? If you have a motor vehicle that is crushing through your leg, it means that the steer wires are the steer wheels are moving on your leg. Is it clear? In that case, you're going to have a crush injury. And what is the major complication of crush injury is that you are going to have a crush syndrome. And a crush syndrome is when the rhabdomyolysis results to an acute kidney injury with a mechanism of acute tubular necrosis, because those rhabdo myoglobin is going to be toxic until the level of the nucleus of the tubules, so it causing acute tubular necrosis, which can cause acute kidney injury. And you have other causes of crush syndrome like hyperkalemia, which can cause a sudden cardiac arrest. So those are the different elements you have to know. Now, after the crush injury, you have to know, so those are the many types of injury that you have. Is it clear? We have also rotational injuries. Is it clear? So somebody may be turning around, still with torsional injury. They are slightly different, though they are similar, but they are slightly different. Rotational injury, torsional injuries. We have also simply falls. Falls are also other types of injuries. Is it clear? Patient that just fall from a height. Is it clear? There are types of injury, and there are falls. Falls can enter under blunt injury. It can also enter under compressional injury type, because if you fall on two of your legs, the side that is more impacted is the axis. If you fall on both legs, the side that is more impacted is the axis of the body, that's the level of the spine. So you're going to have a fracture at the level of the spine, because as if you're taking an inverted weight on your body. Is it clear? So those are the different things involved with the mechanisms or the cause for you to have a fracture.